presenter PowerPoint mode. So that's why I'm going to leave it like this, just for this few minutes when I open up. So we're just so grateful that you chose to spend this time with us tonight, because you could have been anywhere else. You could be reading a book, watching TV, but you decided to spend some time with us. So thank you so much. Those of you who don't know me, my name's Laura Siepko. I live in Charlotte, North Carolina. And my professional career, almost 2 decades, I was in the pharmaceutical device and biotech sales and leadership positions within those companies. And then after that stint, I was in learning and development. And I still do consulting in the learning and development field. I'm a writer and a facilitator. My real passion, though, is to be a wellness advocate. For several years, I have found solutions that have had a large impact on my health and well-being, and I've always had a passion to learn about those things and share them with others. And that's why I was so excited when I discovered CBD, how it promotes overall well-being, and that it comes from a plant, which is pretty amazing. And so I really feel that everyone needs to know about it. And so I'm delighted to have the opportunity to share information with you about it tonight. So what we're going to do, here's a little bit of a roadmap for our discussion, is that we'll discuss the science behind CBD, the 7 indicators that you must look at in quality CBD, and then we'll talk about Green Compass CBD and the solutions that we have. Before we jump in, I want to just put a disclaimer out there that we will not claim, like I will never claim that these solutions are going to cure, prevent, treat a disease. Our goal is to educate about CBD and the potential benefits that it can offer. So before we jump into some of those things, I'm going to take Mr. Bender off mute, and I'd like to introduce Phil. Phil and I have known each other for, gosh, 2 decades probably.
You don't want to mention that.
Yeah, you don't want to mention that. But Phil and I, we partnered together at our job in a long-term care group at Johnson & Johnson. And CBD, which is really cool to me, has reconnected us. So with that in mind, I'm just going to turn the floor over to you, Phil, so you can share your journey with CBD.
Okay, and I'll try to make this as brief but as complete as possible. In January or February of 2018, I was sledding with my 5-year-old grandson, the one that peeked his head in the door. And as coming up a hill, I slipped and fell, and I fell on my right knee, and it was hard-packed snow. I didn't know it at the time because it hurt, but not extremely bad. And the next day, though, it was very painful. I could hardly walk. So I went to the doctor. Doctor said, "You tore your meniscus, and we need to repair that." They did an MRI on it, and they said it's a pretty significant tear. So they scheduled the surgery then for like March or April of 2018. I went in, had the procedure done endoscopically. They cleaned it up. She said, I'm now bone on my knee. And she said, you have significant arthritis in that knee, so it's going to hurt. And that was putting it mildly. It really hurt. I had to use crutches. I eventually graduated to a cane. They were giving me steroid shots. They were giving me lidocaine shots. They were giving me prescription NSAIDs, non-steroidal anti-inflammatory drugs. They were giving me Euflexa, which is a kind of a synthetic synovial fluid. And that helped, but it still didn't take away the pain. I still was in quite a bit of pain, and I thought, I'm going to have to live with this the rest of my life. I'll be using a cane a lot earlier than I thought I would. And so somehow I came across the fact that CBD is a really good anti-inflammatory. And I didn't know anything about CBD at the time, but I ordered some, and I started taking it, and I was amazed at what it did for the pain. It's a great anti-inflammatory, and it must have reduced the inflammation around my knee to the point where I was virtually pain-free now. But I was still on all these other drugs, and they were still giving me shots. So I thought, well, I'll see. I talked to my doctor about that, and she said, well, why don't we just try taking you off all this stuff, and we'll see how it goes. And I said, fine, let's do that. So we stopped the steroid shots, we stopped the lidocaine, we stopped the NSAIDs, and I kind of tapered myself off the NSAID. I was a little nervous about it. And then Euflexa, she said, I'm not going to give any more Euflexa shots. Let's see how it goes. And if it doesn't work, we'll go back on these things. So, but lo and behold, it worked. Ever since then, I have been pain-free, virtually pain-free. The only time I ever had pain in my knee is when I'm getting in and out of the car, or I twist my knee a certain way. It might give me a little twinge, but it's very temporary. When I'm walking, just everyday stuff, up and down stairs, it gives me no pain at all. In fact, I forget that I have a really bad knee. I mean, she was talking like knee replacement surgery, and that's not even a conversation at this point. So I now take 1,000 milligram. I use 1,000 milligram bottle of CBD. I take 1 milliliter of it, which is about 33 milligrams a day. I take that at night, right before I go to bed, and that's all I take of the CBD. I don't take any other medications for it. I don't take any over-the-counter pain medications. I don't need to. It's been that good. So that's my testimony in a nutshell. I do want to add one thing, though. In February of 2019, I had a heart attack. Came out of the blue, not overweight. I'm in pretty good shape, very active. And but one day at lunchtime, I had a heart attack. And fortunately, got myself to the hospital quickly. Well, the ambulance got me there. I called 911, described what was going on. They said, we're going to send an ambulance. They took me up. I got 2 stents, actually 2 stents on top of each other. I had another heart attack while I was on the table. So, and I thought I'd have significant heart damage. In fact, they thought maybe I would, and thought I might even go into heart failure, because they said that's very unusual for this to happen. But when I did all my tests and went through cardiac rehab, did all my tests, they said I had minimal heart damage. So I was really curious as to what role CBD might have played in that. So I started some research. In my pharmaceutical background, I did a lot of that, as Pam and Laura would know. And I looked up some studies on CBD and the cardioprotective properties of CBD. Now, they only did rat studies, but that was good enough for me. Study, they can't do it on humans, obviously, because they killed the rats, but to determine how protective CBD was. And then they induced heart attacks in them. And they wanted to see how much it protected the heart, how much heart damage was done. And they found out that when they gave the CBD versus those rats that didn't get the CBD, that there's a significant difference between the heart damage or lack of heart damage in the rats that got the CBD and the rats that did not. So I am convinced, and my cardiologist is a little bit convinced, that CBD really protected my heart during that heart attack. And it was in the LAD, which is called the Widowmaker, and it was 100% blocked. So I should have had significant heart damage, and I didn't, and I don't. So I showed the studies and I gave the studies to my cardiologist, and typical cardiologist, she says, well, you know, they're in rats, right? I said, I said, they're not gonna induce a heart attack in a human being, right? He said, that's correct. So he's a really good cardiologist, and I think he kind of took it to heart. But I continue to take CBD, and I'm grateful that I was on CBD when I had my heart attack. It was for another reason, but I think it gave me some protection. So that's my story. I'm very happy with CBD, and will never ever give up taking CBD.
Thank you so much, Phil. That's his story, and he's sticking to it.
I'm sticking to it.
But honestly, it's a miraculous story, and a reason why I'm so passionate about this, because you hear stories like this so often. So thank you for sharing that, Phil. I'm going to jump into just a little bit of the educational piece here. A lot of people know this, but we'll just level set a little bit about there is confusion out there. What is marijuana versus hemp? If you look to the left of the slide, cannabis has two species, species 1 and 2. Species 2 is marijuana. We all know that that is what has THC in it and can get people high, right? Very, very low amount of CBD, high amount of THC. The CBD obviously comes from the hemp plant. It's actually the most abundant and non-intoxicating compound in the hemp plant. And actually in the hemp plant, there are over 400 active compounds that are developed in that plant as well. And obviously it has no psychoactive properties and a very, very low trace amount of THC. But why is there so much noise around this in the market is, number one, it's legal to grow in all states, and it's very safe for all ages and very safe for pets as well. In addition to that, it was the discovery of the endocannabinoid system, which I'm going to talk about in a second. But Phil mentioned studies. And if you go on National Institute of Health, their website, nih.gov, you'll find hundreds of studies on THC, CBD, and hemp. So there's a lot of studies. There are a lot of studies out there. And also Project CBD is another great resource to get information about CBD. So if you need whoever invited you to this call to share those with you, please reach out to them. The endocannabinoid system. Okay, it was discovered only in the 1990s, and this is the key bodily system that helps our body maintain homeostasis across all 11 major body systems so that we work in concert together. If they're working well, it's naturally healing the body. The CBD system replenishes the body system so we feel our best both physically and mentally. And how that works is, if you look at the figure on the right hand of the slide, you know, there's all those little dots are CBD receptors. So the CBD receptors in the endocannabinoid system are kind of like a lock. And then when CBD goes in and kind of triggers and touches into those receptors, they stimulate the receptors. And that's really what enhances the CBD and the effect in the body and making our body system go into homeostasis. And so you see the CBD1 and CBD2. The CBD1 receptors are most abundant in the CNS system, and CBD2 are most abundant in the immune cells, the GI tract, the peripheral nervous system, and they have a very nice anti-inflammatory effect. Again,
hey, Laura, I'm sorry. I don't mean to interrupt. Do you have the slides up? Can anyone else see the slides?
Oh, goodness.
No, they're not up.
Oh,
okay.
Elise.
Sorry, I didn't mean to interrupt you.
You are not interrupting. I thought I heard them. I'm talking about slides. And
there they are. There they are, and they're beautiful. Okay.
There we go. I'm going to go back. Thank you. Rookie move. Right, here we go. So this is the first slide I showed that talks about the cannabis and the hemp and the marijuana, right? So it talks about the differences. This is the next slide when I'm talking about the endocannabinoid system and the receptors. I appreciate that, Elise. So those are the two slides that you missed. Here are the 11 organ systems in the body, and that's really what's incredible, that one plant can impact so many things in our body. But what does that practically look like for us? CBD has a very, very broad array of potential benefits. That's one reason why it's so popular if you look at everything that is possible for CBD to support. And again, CBD2 receptors, when they're activated in the brain, they can have a localized anti-inflammatory effect. And you know that many of the neurodegenerative diseases are related to chronic brain inflammation, Alzheimer's, Parkinson's. There's a lot of research in that space. And again, when the CBD1 receptors are activated many times, people will experience reduced anxiety and pain, mood stabilization, feelings of overall well-being. So again, it brings your body back into balance and really helps support your body in handling the everyday stresses that we face, those external stresses that we face. And it comes from the earth, which is really amazing. And so we're going to go through the 7 key indicators of quality CBD. And this is why I truly was sold on Green Compass. I will share the facts about why these things are important and how Green Compass CBD nails these on the head. And one thing I wanted to say before I got into this is there is a lot that this industry is not regulated yet. So that's an issue out there because there is a lot of not so good CBD, and our company is welcoming regulation because we want to be sure that the consumer, that the people who are buying CBD are getting the best CBD. So once the regulation comes into place, there will be less companies most likely on the market because there will be requirements in place to what they're, how they're producing it and how they're presenting it to the world. So the first thing, number 1 of 7, certified analysis. The product should specify the total amount of CBD content and provide certification from a third party to prove what's in the bottle. That is absolutely critical. Actually, Green Compass takes our CBD from the seed all the way to the bottle. The only people that touch it is the third party. That's it. And that's so important because actually 80% of the CBD right now in the United States is imported from China. And so what will happen is it'll be white labeled and a company will just put their label on it. And there might be not enough CBD in it. There might be too much CBD in it. So if you don't have the third party certification, then you might as well not buy it. And what is shown on this slide is a detailed description of everything that is in that bottle. If you Google Dr. Oz, you might have seen the stories that he has had on TV about his team going out and taking CBD off the shelves and testing it. And what they're finding is what's in the bottle is not what the label says. So every bottle needs to have a certified analysis. The other thing is the clean soil. Hemp absorbs contaminants, so the soil must be clean. And again, back to China for a second, they grow hemp to clean their air. So if they're creating CBD from that hemp that is cleaning their air, you can imagine the contaminants that might be in that CBD. In addition to that, being organic is key. Now, the USDA just put approval on allowing hemp to have their certification. So you must grow on organic soil for over 5 years to get that certification. And so that's a really big deal. And so Green Compass will be one of the first to have that certification for our hemp. And that will be on our website very, very soon. We have our papers in with the USDA to get that on our website, which is very soon. So that just gives you, that's the papers that we send into the FDA, just the proof that we are going towards that certification. So we're very excited because we will be probably the first in North Carolina and one of the first out there as well. And again, we've been growing on that soil our farmers, I should say, have been growing on organic soil since the 70s. How is the CBD extracted from the plant is very important. So carbon dioxide extraction is not the least expensive, but it's the most environmentally friendly. And it also preserves the cannabinoids. So that's the optimal way to extract it. The other thing is, what part of the hemp plant is the CBD being pulled from? If the stalks and the leaves are in that, it dilutes the CBD. So it's important to have a CBD that comes only from the flower, which is what Green Compass has. looking at the color, why is clear and golden important? Well, that shows how pure it is. The clearer and the more golden color it is showing that the byproducts are removed from that CBD and it's pure. And the carrier oil is important as well. Coconut oil can carry more CBD molecules and deliver more to our cells for absorption. And it also breaks the blood-brain barrier, and we actually want it to do that with CBD because the brain is obviously controlling our body. We get a lot of questions about how soon will it work? What is your dosing? Well, I pulled this from a website about CBD, and this is what we kind of recommend. It's the most common recommendations to find your sweet spot is microdosing and just starting off with a couple drops and moving yourself up over a few days, because the dose, it's very, very interesting. It's not like taking 2 aspirin and your headache will go away. Some people need just a very teeny tiny dose to have the results, and some people need higher doses. And so everybody's body is very differently, and that natural oil coming from the earth is going to react in your body differently than someone else's. So that's why we do microdosing, because again, some people need a teeny bit, some people need a lot more. And then how soon? I get that question a lot. Some people have miraculous results in just a few days. Some people have slow, steady results over time. Personally, I use CBD really for my overall well-being. I don't have any major health issues. I have a touch of anxiousness and some sports-related pain, and so our solutions have really helped me be a little more calm and really helped manage my sports-related pain. And one of my friends, Beth, is on here. She knows what I'm talking about. Before we dig into some of our products, I pulled this from a recent article that was published in Direct Selling News, and it just talks a little bit about the company, and that's why I fell in love with this company. Just a snapshot on the history. As you can see, it says we started as a word-of-mouth, homegrown CBD business. This company was started in Wilmington. We're based out of Wilmington, North Carolina, and it was started because Meredith Cook suffered from postpartum depression. She took CBD, and she had wonderful results. When her kids got older, she wanted to give them, whoops, did we lose our slides there? Did anyone lose their slides there? Whoops. Here we go. Sorry about that. She wanted to have the opportunity to give them CBD as well. And but she didn't trust giving them CBD, even though she took the CBD. She wanted to make sure she knew what was in it. So she asked her husband, who is one of the top international sweet potato farmers in the world, if he could maybe work with his team to create CBD. So he went with, and he contacted some folks that he knew from the farming industry. They decided to start creating CBD. They decided that, this works really well. Their friends and family loved it. So they wanted to, start promoting it to doctors' offices and chiropractor offices. But what they really found is that telling people about it, word of mouth, was just the best way, because people really trust other people's opinions. So that's how they kind of decided to go about this company and having the social selling model, as we call it. These are the farmers, Adam and George Wooten. They have 6 generations of agriculture experience. So they help farm our hemp. And they are licensed participants in the North Carolina Hemp Project. They're leaders in the industry. They actually train other farmers and work with the University of North Carolina, as I shared. And they truly believe that quality is everything. So they have an extensive amount of experience, and everything is done by hand, actually. We don't use large machinery when growing our hemp. This is just another little pull from an article about our research partnership with the University of North Carolina, Wilmington. We actually have a lab on their property, and we're working with them on research and development of new delivery systems, technologies, and benefits utilization of CBD. So it's really exciting. This company is doing a lot of exciting things, but we will always put quality first. So if you look at our products, we have our tinctures. Phil spoke about the oil and the tinctures that he uses. We have several different strengths, several different flavors. We have full spectrum, which again is the whole flower. You get all the benefits. And then we have THC free, that is just, it's just pure CBD. We also have CBD for pets. Pets, they have an endocannabinoid system. Every mammal does. And so they oftentimes will struggle with pain and anxiety, sleep, inflammation, and those who love our pets will understand this. And this is just a picture on the left side of a friend of mine. Her dog struggled with fireworks and storms, and as you can see, after a little CBD, they were feeling a lot better. And another woman actually on our team, her dog has been seizure-free for 2 years since he's been using CBD, which is quite amazing. We also have topical creams. This one is great for sore muscles, joints, and skin conditions. The reduced cream on the right is actually my favorite product with Green Compass. It's proven to help reduce pain in contact. It's an FDA registered product. It's amazing, and the pain patch actually people can experience instant relief of pain for up to 96 hours. So you can leave that patch on because it's water resistant. We also have bath soaks, 35 milligrams of CBD. As you can see, you can get refreshed, rest, or relax, but these have essential oils in them as well. And then we have lip balm, hand, foot, lotion, and scrub, but we have much more to come. Actually, this weekend we'll be launching some new solutions, but in just 11 months, this is everything that our product line, and again, it will expand because our vision is to meet the market demands. And the company truly has, because in only 10 months, the organization's goal was to sell $1 million of CBD, but the organization has gifted so many people with CBD. They've benefited so much that we've actually sold $10 million of CBD, not because we had shelf space, not because we have fancy marketing. It's because people just share their personal experience with other people, which is quite remarkable. And so a little bit about Green Compass. We're focused on quality, compliance, and culture. And the company is totally committed to improve the overall well-being of their customers. We are 100% focused on CBD. We're not focused on, making protein shakes or any other thing with CBD wellness products. We have the U.S. Hemp Authority seal of approval. We have an expert team of industry professionals, not just our farmers, but also we have a corporate lawyer, an FDA lawyer, an MLM lawyer, and a cannabis lawyer, because we want to do the right thing, and we want to be 100% compliant. The company also offers a 30-day empty bottle guarantee, or any product that you're not satisfied with, we will fully reimburse you for that in the first 30 days. And again, our partnerships with the universities allow us the ability to adapt to the growing demand for innovation and to make innovative CBD product. So we'll wrap up. So again, I kind of shared a little bit why the company went the social marketing model, is because it was word of mouth. But I think some of these statistics are interesting, is that network marketing is truly the #1 way to get products to consumer globally. It's a $178 billion industry. And within that space, health and wellness is the largest percentage. And within health and wellness, alternative products like CBD are dominating. In fact, CBD is the fastest growing. And as you can see, right now, it's poised in the next 3 years to grow from a $500 million market to a $20 billion space. But it's so critical that people are educated and that they get quality and pure CBD so they do have good results, because that's truly our mission. And we really feel that this company has it all right with the product and the leadership and the compensation plan, is that the product, we've shared what an amazing product it is, but also from a compensation plan, it's just, if you have a product that people will buy without being compensated for it, that's really a win for the social selling model. And we have leaders with a vision and a commitment. So that's, it's kind of interesting how this company fell into this model by accident, but I think it's a true gift, because people just like Phil did tonight, and my friend Elise another night, have the opportunity to share their personal testimonies and how it's really it's really changed their overall daily life, which is pretty amazing. And how do you get started? If you want to order, you can be a customer. We love our customers. You can buy one time and pay the full price. You can become a preferred customer, buy whenever you want. Just develop an account, and you don't have any obligation of what you have to buy, when you have to buy, but you do get 20% off of it. If you decide that you want to be a social seller, and just tell people about it, you can do that for $50, or you can buy this kit that's, worth almost $700, and you get all that product. But with that said, I just wanted to thank you. Our team is so grateful that you joined us tonight. Again, as I said at the beginning, you could have been anywhere, and you chose to be here with us. So we thank you for that. And, the mission of our company is truly to be the leader in the industry, but that starts with our commitment to quality. And as our CEO has said many, many times, quality is everything. So thank you, everyone, for coming. Please follow up with whoever invited you tonight with any questions you have. And we just look forward to serving you in any way that we can. Have a wonderful night.
Thanks, Laura.
Thank you.